to the SABC News COVID-19 Global Wrap, where we bring you highlights of stories that dominated news across the globe with regards to the coronavirus pandemic. I am Pabalolo Phaka, and I'm with my colleague Busisiwe Khatebe. But before we get into it, let us have a look at where we are standing globally with regards to statistics on the coronavirus.
Global statistics are sitting at over 3.2 million cases, over 1 million recoveries, and over 200,000 deaths. And in South Africa, we are sitting at over 5,000 cases, over 100 deaths, and over 2,000 recoveries. Health Minister Dr. Zweli Mkhize says that the national lockdown has assisted in slowing down infections.
We did address the media a few weeks ago, 2 weeks ago. We indicated that the lockdown helped us to reduce the rate of spread. It didn't stop the spread. It just meant that the one person who's got the infection will spread it to fewer people than would have been before. So we are quite pleased with what has happened, and therefore our model does show as well that even if we made the lockdown longer, it would not have necessarily pushed the curve much further than what it is already, which in other words means that at the point when the president says we need to be starting to ease down, it actually was based on the scientific projections that when the lockdown is eased, of course, not just all of a sudden, but that lockdown ease was based on the fact that all our calculations proved that there wasn't going to be any further benefit in terms of the epidemiological conduct of the outbreak if we went further than that.
Level 4 national lockdown officially started on the 1st of May, which means some restrictions have been eased. People can now go for walks, jogging, and cycling between 6 a.m. and 9 a.m.
You can cycle, you can run, you can walk, but it will have to be within your neighborhood, within about 5 kilometer radius of your neighborhood, your home. And it will also be not under organized groups. Can't run as a club or as a group. But you also can only do that between 6 a.m. and 9 a.m.
However, the sale of cigarettes and alcohol is still prohibited.
More than 2,000 people opposed it. And of course, the government then took that into consideration, debated the matter, looked at it, and decided that we must continue as we are when it comes to cigarettes, tobacco products, and related, that we should not open up the sale of products. And the reasons are health related.
Minister of Basic Education, Angie Motshekga, and Minister of Higher Education, Blade Nzimande, on Thursday outlined preconditions in which schools will be reopened.
One of the measures that have been put in, though, for phasing in this is that there will now be a limit of a maximum of 40 kids per class. It's a real problem for schools, especially township schools and rural areas where overcrowding has already been a problem outside of the limitation of numbers. So the department says it will now look at adding capacity in terms of mobile classrooms so that they can move kids out of classes to prefab structures to cater for social distancing. There are some schools where you would have a desk that fits 3 children. Only 2 kids will be allowed to sit in there.
Sure.
That now puts the need for additional teachers. The department says it's talking to Treasury, it's making arrangements for additional teaching posts so that when kids are moved to the prefab structures to ease the numbers, there will be teachers in those classes as well.
Yeah.
So those are some of the issues that are being put into place. There are school learners who have pre-existing medical conditions. We know in South Africa there are children who are born already infected with HIV. Some have contracted TB in their communities.
Yeah.
Those children will be encouraged to learn from home.
Yeah.
The department says the same will apply for teachers that are older, that are close to 60.
Sure.
They will be encouraged to work from home because those two fall into those high-risk categories when it comes to COVID-19.
Cuban health workers have arrived in South Africa as an additional medical resource to help fight the COVID-19 pandemic. While some political parties have welcomed this move, there are some who have leveled criticism against government.
My spirits were lifted last night when I heard that 219 Cuban health workers had landed in our country. This follows the request I made to the President of Cuba when the coronavirus was beginning to rear its head in our country, and I asked the Cuban government to send us their specialists. And indeed, they have lived up to that. We sent a plane, but we also sent medical supplies to them. As you know, they are still facing a really terrible blockade. So the medical supplies also went to Cuba, but the plane brought back all these specialists, epidemiologists and pandemic specialists and many others.
On Monday, South Africans celebrated Freedom Day under the national lockdown.
Today, we are celebrating the 26 years since the ushering in of our democratic dispensation. We are doing it under very difficult and different conditions, when all of our people have been requested by government to stay at home as part of the fight we are waging against this invisible enemy called COVID-19 rashes.
As we celebrate this freedom under the spectre of the coronavirus in South Africa and under lockdown, it perhaps gives us even more time to pause and reflect on just how important our freedoms are. In this time when many of our freedoms have been limited to stop the spread of the virus, we now need to acknowledge that these are freedoms that we must never ever take for granted.
The 1994 dispensation came after decades of political struggle, and ultimately it led to the negotiated settlement that gave us our constitutional democracy. It is important for us to remember that 1994 did not come as a result of the goodwill of the leaders of apartheid regime, as many would like to have us believe today.
We are celebrating this freedom today being indoors due to coronavirus epidemic. And we hope that sooner or later this thing will be a thing of the past.
In the rest of the continent, Algeria has eased some restrictions for Ramadan. Burkina Faso and Ghana also eased some restrictions to test the possibility of a return to normalcy.
Shoe trader Usman Zongo is opening his store for the first time in almost a month as Burkina Faso and neighboring Ghana test an easing of lockdown restrictions. For Zongo, it's a relief. He says his family has suffered since Ouagadougou's markets were closed on March 25th and have been spending money they do not have in order to survive. Authorities are reopening the Burkina-based capital's main market as a test to see if they can safely do same with the rest by the end of the month. Sellers and customers have to wear masks, wash their hands and have their temperatures checked in order to enter.
The Jack Ma Foundation has sent a third batch of medical supplies, which include masks, ventilators and testing kits, to the Africa CDC and the African Union.
Millions of face masks and coronavirus detection kits, donated by Chinese billionaire Jack Ma, arrived in Addis Ababa on Sunday, as the number of cases in Africa rose. Although the advance of COVID-19 has been slower than in Europe and Asia, the disease now has a foothold in most countries on the continent, and there have been dozens of deaths.
The African continent has recorded over 37,000 cases, over 1,500 deaths, and over 12,000 recoveries.
And now for some international news. The United States of America has recorded over 1 million COVID-19 infections and 55,000 deaths. In a tweet, Trump said, The only reason the US has reported 1 million cases of the coronavirus is that our testing is so much better than any other country in the world. Other countries are way behind in testing and therefore show fewer cases. The United States is adamant that China failed to report the seriousness of COVID-19 in a timely manner. Trump told reporters that his administration will launch a serious investigation into China.
The fact is that there has been so much unnecessary death in this country. It could have been stopped, and it could have been stopped short, but somebody a long time ago, it seems, decided not to do it that way, and the whole world is suffering because of it, 184 countries at least. We are not happy with China. We are not happy with that whole situation, because we believe it could have been stopped at the source, it could have been stopped quickly, and it wouldn't have spread all over the world, and we think that should have happened. So we'll let you know at the appropriate time, but we are doing serious investigations.
However, China did not take kindly to Trump's comments and accused the US of lying and spreading false information.
I'd like to stress that the US politicians are ignoring the facts and lying repeatedly with the sole purpose of deflecting attention and responsibility for their insufficient response to epidemic prevention and control at home. But facts speak louder than words, and justice naturally lives in people's hearts. Their attempts will never succeed. The US politicians' attempts to shift the blame on China will not denigrate China's efforts in responding to the virus, nor will they help the US in its epidemic prevention work at home. They will only further expose the sinister intentions of the United States and its own problems.
And staying in what was once the epicenter of COVID-19, China has managed to ease lockdown regulations and allow economic activity. Economists have, however, cautioned that it is still too early to presume that the Chinese economy is growing again. In Europe, British Prime Minister Boris Johnson returned to work on Monday following his recovery from COVID-19. He warned that it is still too early to relax stringent lockdown measures over fears of a deadly second outbreak. Health officials said the country still has a long way to go in its attempt to fight the spread of COVID-19. And in Italy, factories and building sites will reopen from May 4th as the country prepares a phased end to Europe's longest COVID-19 lockdown.
For the latest updates on the coronavirus, visit sabcnews.com.